This video is not intended to diagnose, treat or cure any disease. Better Way is just a YouTube channel where you may find useful solution to everyday problems from reliable sources of information. Please subscribe to give you more useful information.
The following medical advice comes from practicing doctors. The question we will answer today is, how do I know for sure that my condition is so serious that I have to go to the emergency room? When I already have some symptoms of COVID-19, there are many people who want to monitor their symptoms at home. The advice we give is to stay at home and follow the doctor's treatment until the symptoms become more severe. But what does that mean? How do I know when my symptoms are so severe that I should go to the emergency room? We must remember that most people will have mild symptoms, fever or dry cough. Those who have more severe symptoms are those who usually have other health problems, are usually people over the age of 65 and have other comorbidities, such as hypertension, diabetes, lung or heart disease. A very safe way to monitor your health is to measure the level of saturated oxygen in your blood. So measuring the level of oxygen in your blood can save your life or that of your loved ones, because it will clearly show you if your health has deteriorated drastically, and urgent measures must be taken. Measuring the level of oxygen in the blood can be done very easily in the comfort of your home with a small device. This device is called puls-oximeter and is available on Amazon.com at a price of about $20. And it is very easy to use. You just have to put your finger in the device and in about a minute you will have the result. We do not believe that everyone should have this device, but for those who are predisposed it is very important to have an oximeter pulse in the house. It can actually save their lives, because they can take action in time. Pulse oximeter measures your oxygen saturation in your blood. A normal saturation is between 100 and 95. All values below 95 are worrying, especially if you have other symptoms of COVID-19. If you have an oxygen saturation of less than 95, it means things are not going well and you should consider going to the emergency room. When you breathe, oxygen enters your lungs, passes through thin membranes and enters your bloodstream, where it's then picked up by red blood cells and carried around the body to various organs. A pulse oximeter is a tiny device that usually slides over your fingertip and uses infrared light refraction to measure how well oxygen is binding to your red blood cells. Oximeters report blood oxygen levels via an oxygen saturation measurement called peripheral capillary oxygen saturation. In fact, there's a phenomenon we've observed clinically where a person with COVID-19 can have very low oxygen levels but otherwise appear well. Happy hypoxia. It's concerning because these patients may be more significantly ill than they feel, certainly warranting closer attention in a medical setting. If a person has a mild case of COVID-19 and is self-treating at home, an oximeter can be a helpful tool for checking oxygen levels so that low oxygen levels can be caught early. In general, the people who are theoretically more at risk for oxygen issues are those with pre-existing lung disease, heart disease and/or obesity, as well as active smokers.
Hope this information will be helpful for you. Please subscribe our channel in order to help keep up the good work.